I'm Dr. Sergio Vañó Galván. I'm a dermatologist from Madrid, Spain, and I'm the current secretary of the European Hair Research Society. I'm the director of the Hair Disorders Unit at Ramón Cajal Hospital, and I'm also the director of the International Master for Hair Disorders and Hair Transplantation. Tomorrow I will talk about the safety profile of low-dose oral minoxidil in some special populations: elderly patients, patients older than 65 years old, and patients with hypertension. In the first group, we have seen that the low-dose oral minoxidil has also a good safety profile. Only 2.8% of the patients had to stop the treatment due to side effects. And the main advice is in this profile of patients to use low-dose oral minoxidil in a daily basis rather than every other day to avoid the main side effects, which was tachycardia. On the other hand, in patients with hypertension, it was demonstrated that the rate of discontinuation in patients with this disease was more or less the same as the general population, about 1.5%. So we can reassure the dermatologist to prescribe low-dose oral minoxidil in patients with hypertension. Probably, like in the past AAD and EADV congresses, the main topic from a scientific point of view in hair disorders is the use of JAK inhibitors for alopecia areata. The approval of baricitinib and the approval of ritlecitinib has been like really important milestones in the treatment of that disease, and we will have other future approvals like upadacitinib, and we can say that the effectiveness and especially the safety profile of these drugs will allow us to manage patients with severe alopecia areata in an amazing way. We will be able to maintain the treatment for years, and we will be able to improve the quality of life of these patients. In hair disorders, I would summarize three main fields of research for the future. The first one is the regenerative medicine, of course, the hair cloning, but even though different treatments that will allow us to improve the hair density in a dramatic way with these type of treatments will be probably the most important milestone in the future. We cannot see these results in the early future, but I'm sure that in the next years we will see these advances. In second place, the use of the current drugs, but optimized, like for example, the long-release oral minoxidil or some drugs that will be applied in mesotherapy and will produce the effect with lower side effects. And in third place, I think that the combination of the medical therapy with hair transplant and cosmetic procedures like trichopigmentation, the micropigmentation of the eyebrows of the scalp, hair transplant in combination with regenerative medicine. I mean, the holistic approach, the 360 degrees approach of our patients that as dermatologists will allow us to improve their quality of life.